Hi, my name is Katie Campo, and I'm going to be demonstrating on how to do a med pass on Taylor Schneider, who is also a nursing student. Taylor, do you give verbal consent?
Yeah.
So first, I'm going to start by entering the med room and logging on to the EMR. So I'm first going to review the patient's name and their profile. So their name is Michael Head, and they were born on 4/24/1944. I'm then going to review the order. So they have ordered a furosemide dose of 80 milligrams at 1100, and by looking at the time, it is 1100, and so this should be given at this time. I'm then going to review my nursing implications. So Michael is allergic to sulfa, but after looking in my drug book, there is no interaction between furosemide and sulfa. Furosemide is a diuretic, and after looking at Michael's vitals and his lab reports, he has a buildup of fluid, so he has a lot of edema right now, and he also gained 10 pounds within the week, so this will help flush out the fluids in his body. And this should be taken on an empty stomach, and Michael has not eaten within the past 2 hours. I'm then going to log on to the AccuDose. Okay, so now I'm going to verify the 6 rights. So right person, so on the EMR it says Michael Head, and on the AccuDose it also says Michael Head, and their date of birth, 4/24/1944 on the EMR, and also 4/24/1944 on the AccuDose, and their MRN numbers match on both the EMR and the AccuDose. And then I will move to write medication. So medication on the EMR says furosemide, and on the AccuDose it also says furosemide, so those two match. The dose should be 80 milligrams on the EMR, this is what that says, and on the AccuDose it says 40 milligram tablets, and to give him 2, so that would make that 80 milligrams. And then right route, the EMR says oral, and the AccuDose says tablet, and tablets can be taken orally. And then right time, so time due is 1100, and by looking at the time right now, it says that it is 1100, so this would be the correct time. So then the last right is documentation, but this will be done after the patient has actually taken the medication. Okay, so lastly, I'm going to dispense my meds. So just by looking at my medication, they are both intact, the bags are not ripped, the medication is intact, and the expiration dates, neither of them are expired. They expire 12/22, which means they are not expired. So now I'm going to log out of the AccuDose, which is very important for HIPAA, and also log out of my EMR, and now move to the patient's bedside. So I'm going to introduce myself as Katie, her nurse, and I'm also going to identify Michael with 2 different identifiers. So, sir, can I please see your wristband? So I see that their name is Michael Head, and that their birthday is 4/24/1944. I'm then going to explain the purpose of the medication. So you are going to be receiving furosemide today, so that is a diuretic. So that will help with your edema and help you lose the pounds that you gained in the last week that were due to water weight. So now I'm going to log onto the EMR. And I'm going to scan the patient's wristband. Scan your band. Beep. And then I'm also going to look at their allergy band. So it also says that they are allergic to sulfa, which matches what the EMR says too. Okay, so now I'm going to begin scanning the medications. Beep. Can I also scan your wristband one more time, please? Beep. Okay. So before I administer this medication, I'm going to verify the 6 rights once again. So on the patient's wristband, we see that their name is Michael Head, which matches the EMR, and also their birth date matches 4/24/1944 on the EMR, and their MRN number on the EMR also matches on their wristband. So, and then furosemide we are giving This matches what is on the baggie and what is on the EMR, and also the dose. So we have two 40 milligram tablets, so that makes 80, which matches on the EMR. And then we also have the correct route orally, so the patient will be taking these in a medication cup, which will be taken orally. And then right time, it is 1100, so this is the correct time to give the patient their medication. So now I'm going to, so the last right is documentation, but again, this will be done after the patient takes their medication. So I'm going to make sure that the patient is sitting upright, and I'm going to hand them their medication. And I'm going to observe the patient swallow their medication, and then I'm also going to verify the correct time and make sure I log this onto the EMR. So this was taken by the patient at 1100 hours. So then I'm also going to scan my badge. I would do this before I verify, but then I would verify on the computer that they had taken it, the correct time and date, and then I'm going to log off of the EMR. I'm going to position the patient for comfort, call light within reach, side rails up ×2, and document my findings.